Hello, I'm Dr. Kieran Soda. In this video, I'm going to be telling you all about your diet during pregnancy. But if you're new to this series, you should also check out my video on vitamins and supplements. I've split this video into two sections. So in section 1, I'll be telling you about eating a balanced diet, and in section 2, I'll be telling you about foods to avoid and some of the extra precautions you need to take. So let's get to it. It's essential to maintain a healthy, varied and balanced diet throughout your pregnancy. What exactly does this mean? Well, apart from the foods to avoid, which we'll cover later, there really isn't anything special about a pregnancy diet. In essence, it's about eating a variety of foods and having regular meals. About a third of your diet should be fruit and vegetables, with another third made up of carbohydrate and starchy foods, such as potatoes, pasta, rice and bread, which are important for energy. The final third should be split into 3 sections. The first section is meat, eggs or beans for protein, and the second section is milk and dairy for protein and calcium. The third section is for fattier and sugary foods, but try and keep your intake of these to a minimum in your diet. Of course, some women feel really quite sick during pregnancy, which can make it really difficult to eat 3 full meals a day. If that's the case, an alternative is to snack little and often, for example 5 or 6 times a day, to make sure you stay hydrated with regular fluids as well. The good news is these symptoms usually get much better after the first 4 months, but if you're struggling with your food, you should see your doctor for some advice on how to manage this better, as there may be alternative options for you. It's really important to be aware of the foods you'll need to avoid whilst pregnant, as well as some extra precautions you'll need to take to avoid infections from contaminated foods. One of the key things is to be extra vigilant in washing your hands carefully and washing all fruit and vegetables thoroughly before eating. You need to be aware of the risk of salmonella, a type of bacteria that causes food poisoning. It's sometimes present in meats and raw or partially cooked eggs, so you need to make sure you cook these foods thoroughly and avoid any foods that contain raw or partially cooked eggs, including mayonnaise, mousses and some ice creams. The next thing you need to be vigilant about is toxoplasmosis, another infection caused by a parasite that can sometimes be caught from eating undercooked or raw meat. To minimise this risk, all foods, especially red meats such as pork and beef, should be cooked thoroughly until steaming hot, with no pink areas. And all utensils and hands should be washed thoroughly after touching meat. Unpasteurised goat's milk is another source of toxoplasmosis, which you should avoid. You also need to be wary of the risk from cold cured meats, unless these are frozen before consuming. That's because the freezing process should kill parasites. Toxoplasmosis is also contained within cat's feces, so you should avoid anything that may have come into contact with cat's feces, including soil. You should wear gloves if you're in the garden, and wash your hands thoroughly if you do have any contact. Wow, this is quite heavy, isn't it? I think we need a short break to take a breath here. Just remember the reason you're making these changes is to keep your baby as safe as possible and reduce the risk of any complications. This will soon become second nature, and you can always pause or re-watch these videos. Right, shall we continue? We need to talk about cheese and pate. Yes, it's delicious, but you need to avoid all pate and certain soft cheeses while you're pregnant, specifically cheeses with blue veins and white rinds, as these can all increase the risk of a rare but serious bacterial infection called listeriosis. However, you can enjoy other soft cheeses as long as they're produced from pasteurised milk, such as the ones on this list. What about fish? It's probably unlikely you're eating a lot of shark, marlin or swordfish, but these are foods you should avoid. That's because they have very high levels of mercury, which can damage the development of the baby's nervous system. Tuna can also contain high levels, so you should have no more than 2 tuna steaks per week. Oily fish, including tuna, mackerel, sardines and salmon, should be eaten no more than twice a week, as they can contain other pollutants as well. So, which fish can you eat? Well, you can still eat white fish, for example cod and haddock. It's fine to eat smoked fish and shellfish as long as it's cooked. Sushi needs to be frozen before you can eat it safely, so you should check with restaurants or supermarkets directly to ensure this has been done. Other foods to avoid include liver, as this can have high levels of vitamin A, and excessive levels can potentially be harmful to baby. See my previous video on vitamins and supplements for further details of which vitamins to take and what to avoid. Game meat that has been shot may contain high levels of lead, so try to avoid this as well. It's safe to have pasteurised milk, yogurts and ice cream, but always double check that they're made from pasteurised milk and eggs to reduce the risk of food poisoning. Caffeine should also be limited, as this can increase the risk of having a low birth weight baby, but it is safe to have about 200 milligrams of caffeine, which is about 2 mugs of coffee or 3 cups of tea. Thanks for watching. I think it's quite hard to take all that information in, but you can always watch these videos again or even take screenshots using your phone, so when you're shopping you can remind yourself exactly what you can and can't buy. My next video is about lifestyle, including exercise and sex, and you can click here to watch that. We've got loads of other videos on pregnancy, so hit subscribe and check them out.